Hi, this is Josh from the Status Dramaticus podcast. Today we have a different kind of episode, and hopefully one of the first of many where I'm going to take video and talk about some topic in a little bit more detail about certain things that we can do in the field and certain things related to skills, practical knowledge, that type of thing. So the episode today is going to be based on pre-hospital blood draws. Why is that a big deal? I think pre-hospital blood draws are great. I think they save a lot of time and they help you arrive at a disposition for a patient much quicker. Also, I think EMS does a great job of collecting these in the field when they're allowed to. There's a couple of things about blood draws. I know there's just a general knowledge of what to draw, but maybe we can go over uh, some ideas of how to better select certain blood tubes for certain situations, or just to have a better understanding of why we need certain blood tubes as opposed to others. All right, so what I've done here is I've just drawn some very poorly constructed blood tubes. I'm trying out a new program here, so I'm going to see how it works out. So what you see right now, we have a yellow top tube, this kind of turquoise, green, teal, however you want to color it, type of tube, a lavender tube, and a blue top tube. Now, this is going to vary depending on what jurisdiction you're in or what hospital you're taking patients to. But in our local area right now, we use these most of the time in the emergency department. So what I wanted to talk about is when to draw these and when to use these, which ones to prioritize, that type of deal. So these first two on the side, this is a recent change, but your yellow top tube and your teal or green, we'll just call it green, but there is another green type of tube that I don't want to get confused with later. So these two right here, I'll just draw this out. They're used for your BMPs. Oh, that's going to take me a long time to write, isn't it? Or your CMPs. Now, it's not really a big deal to know the difference between those right now, but there is a difference. Most of the difference between the BMP and the CMP involves liver enzymes, where this is more comprehensive, the CMP, and the BMP is going to have like your glucose, your electrolytes, BUN, creatinine, that type of thing. So these two are used for that. This one, this lavender type of tube, is a CBC. That's your complete blood count. There we go. I'm getting not too bad. And then this blue one over here is for anticoagulant. I'll just put AC for now. That'll work. So, depending on the type of patient you have, or really we should even start even more basic than that. So if someone's coming to the hospital for an emergency, and we're presuming that it's an emergency and that they have a high likelihood of being admitted to the hospital, they're going to need, at a bare minimum, these two tubes. Now, like I said, remember that these two in the past have been used for the same thing in our jurisdiction, but right now we are prioritizing this green one right here. So at a bare minimum, they're going to get a blood draw of this tube here and this lavender tube, so green and lavender. With some additional tests, they still might, like I believe serum pregnancy is still on the yellow tube. But to think about it, let's say you have a chest pain patient. you already know that a chest pain patient is very likely to be admitted, so they're going to end up with these, the green and the lavender tubes. But part of the testing set for chest pain is going to be a troponin. You can get a troponin out of the green or the yellow, but like I said, remember we're using green in this jurisdiction. So that's a big one, just to have to detect a troponin at some point. So that's very useful for EMS to draw. And then they are also going to get the CBC. Now, if they are on any anticoagulants, some hospital policies will have it that they're going to end up with a blue top drawn for anticoagulants anyway. But there's a trick with the anticoagulants. Now, this goes with all of them. Generally speaking, to reduce the rate of hemolysis, which is a huge issue, and prior to being analyzed, most blood is ruined at some point prior to analysis. And a lot of times this is blamed on the technique or what happens to the tube prior to being analyzed. One of the things that's talked about is being able to fill the tube. Oh, that's not what I wanted. Oh, well, we're going to go with that. You're going to fill the tube to its capacity. I believe the yellow, green, and lavender is around 3 cc's of blood. Now, the blue top is especially sensitive to this. So I drew a little marked line here. On the blue tops, you'll see this clear distinction of the fill bar. And if that does not reach the fill area, then the lab is not going to use it. They're going to reject it. So that one is especially sensitive to the amount in the vial. Now that being said, these are also, all of these have solutions in them to either stop the blood from clotting or to help preserve some integrity of the test that they want to test or what they're specifically looking for in these blood tests. So it's always recommended to fill these to capacity, and that supposedly reduces the rate of hemolysis. And like I said, with the blue tops, you want to make sure that they're at the fill line, because otherwise they will certainly get rejected. And the reason, just to backtrack a little bit, is that these concentrations will be thrown off if they already have a solution in them, and then they're made for a particular volume. The concentrations might be thrown off a little bit if you have some lesser volume in there. So we talked about troponin a little bit. We talked about filling the tubes. If you're going to get an abdominal pain, I mean, drawing the green and the purple top will get you where you need to go. And I think that's basically what we need to know in the field. These four, just knowing these four, we have anticoagulants, CBC, it's going to do your blood counts of your white blood cells, your H&H, all that, and then your BMPs and your CMPs. So let me know if this is helpful. I was planning on making some more of these videos in the future. I like the idea of being able to draw and actively just show things, and this might make the videos more interesting if it's for like something very dry like blood draws. So this has been another episode of the Status Dramaticus podcast. You can let me know if this was helpful at all. Please let me know if this was helpful at all. So you can email me at statusdramaticusrnems@gmail.com. I'm going to post this one up on YouTube. Podbean's not really going to do a whole lot for this since there is visual involved in some of this. Yeah, and that's about it for this week's video. Oh, and next week I've been trying to get more episodes made for the topic of mental health. So if there are questions about mental health that you want answered or some topics that you would like me to investigate or explore, just give me an email or leave some comments in the comment section of the YouTube page. All right, that's it for the Status Dramaticus podcast. I hope you found this helpful about blood draws.